Now, Mirgi ka Daura are just some of the names of seizures that affect approximately 60 million people worldwide. Now, seizures can affect anyone at any time, but unfortunately, very few people know what to do when someone has a seizure right in front of them.
Exactly. So we asked a lot of people what they would do if someone has a seizure, and this is what we found.
They kind of smell the shoe or something, you make them smell the slipper or something, that's what I know.
Call the ambulance, make them smell something.
No idea. What we see earlier was that they used to make some shoe smelling and all, but I don't know whether it's medically it's a proper way.
I think I've read that somewhere that to make them cough really like that shakes the because it helps in some way. I don't know. I read it somewhere.
I think that's what I've heard, that we should take off the shoes and make him smell and immediately rush him to the hospital.
So best is to either have a spoon or a pen or something so that he doesn't bite his own tongue and choke on its own.
We can also put a clove in the mouth of the person suffering from this issue. So it will, within 10 minutes of time, he'll be okay.
पहले ज़माने में तो जूती उतार कर उसको सुंघा देते थे तो कोई फर्क पड़ जाता था।
तो वो सुंघाएंगे उसको इस तरह से कुछ।
कितने आदमी तो मिर्गी में बेहोश होता है तो उसको सर चमड़े के जूता सुंघाया जाता है।
यदि जूती सुंघा देते थे, हमारे यहाँ तो यही रिवाज था जी।
ओल्ड की कुछ प्याज वगैरह टाइप सुंघा देना चाहिए।
मैं बता नहीं पाऊंगा सर, सॉरी।
भैया जूता सुंघाते हैं और
वो जूता भी सुंघाना होता है, जूता सुंघाने से कंट्रोल में आ जाता है बंदा।
मिर्गी के दौरे में उसे चप्पल सुंघाना चाहिए चमड़े की।
As you can see, we got varied responses, with majority of the people saying they would make the person smell a shoe, and that is wrong.
So today, let us tell you what you need to know on what to do when someone has a seizure right in front of you. I am Dr. Sonia Lal Gupta.
And I am Dr. Sameer Gupta, and welcome to Doctors on Call. Our brain is made up of cells called neurons that are interconnected with each other. They send signals across like an electrical circuit. When a large number of neurons get activated, an electrical storm-like situation is created, causing a seizure. When someone has more than 2 episodes of seizures, they are deemed to have epilepsy. Epilepsy can be of various types depending on the symptoms and type of seizures. Generalized tonic-clonic seizures are the most common type of seizures. These are typically the seizures where the body gets stiff and starts jerking, along with the eyes rolling back, and the person becomes unconscious. This is what most people call fits or convulsions.
Now, if someone has a seizure in front of you, these are the things you need to keep in mind. Step 1. Move any dangerous object in the vicinity of the patient to reduce the chances of any kind of injury. Step 2. Place a cushion or pillow under the neck to provide support. Step 3. Loosen any tight clothing, especially around the neck like ties. Step 4. Turn the patient on any one side. This will help move the tongue out of the way and avoid choking. Step 5. Time how long the seizure or convulsion lasts. This information can be useful for the doctor when treating the patient. Step 6. Please don't put anything in the mouth of the patient, including your fingers, as it can cause injury to the person and they might also choke on the object. Step 7. Don't hold the patient down during a seizure, as that again can increase the risk of injury. Step 8. Call an ambulance and stay with the patient till the seizure ends and the patient regains consciousness, so you can offer help and support. Please remember, epilepsy is a treatable condition, so it is necessary to go to a neurologist if you or someone you know has a seizure disorder.
Well, that's all we have time for today, and we hope you've learned something. That's all for now. See you next week.